Good evening, Dr. Wilson and classmates of MHS 599. My name is Crystal Watson and I'm going to present childhood obesity. I will address the problem, my approach to address the problem, and what I learned throughout my research. In 2009, it was estimated that 22 million children were labeled as obese, and 1 in 10 children were classified as overweight. According to the Center for Disease Control and Prevention, obesity is categorized as at or above the 85th percentile and below the 95th percentile for children in the same age and gender groups. My research led to trends that showed that in 1999, the childhood obesity rate was 13.9%. In 2009, the rate was 16.9%. In 2015, the rate was 18.5%. This shows that there was a cultural shift, there was a lack of education, and there was a difference in the community and school programs. Despite that, there has been a lot of great strides made within the community and different organizations attempting to prevent childhood obesity and decrease the rates within our nation. A few of those programs were Healthy Children Coalition, the program We Can, and Coordinated Approach to Child Health. I chose to use program evaluation for childhood obesity. This program was funded in 1988. It was a program proven to prevent childhood obesity. It had 3 focal points: the child, the parent or guardian, and the community, all influencing nutrition and physical education and fitness. With 25 years of experience in research of 10,000 schools and communities within the program, and over 50% of the programs within Texas Use and Catch, this program has been really successful. It was implemented based on the whole school, whole community, and whole child concept developed by the CDC. It integrated all environments to support healthy lifestyle for children. For nutrition, it used GO, SLOW, and WOW. So those 3 groups was used within the schools and communities to show the child what to use for the items that they chose to eat. So GO, very healthy item; SLOW, eat in moderation; and WOW, not so healthy. Very easy, basic. They used it in the curriculum and they used it on posters throughout the schools and community environments. For physical, they believed in research that moderate plus vigorous activity that helped. That made a difference in weight and helped with everything as it related to healthy lifestyles. So they incorporated that into the schools and encouraged the schools to incorporate 60 minutes of physical activity every day within their systems. They also developed a toolbox with 250 activities that teachers were to use every day during their physical activities. With those results, they had an 11% decrease in childhood obesity rates for the children enrolled in their CATCH programs throughout the nation. That's 25 years of experience with over 120 academic papers strictly contributed and related to the CATCH program. Lessons I learned throughout this research: ecological approach related to childhood obesity, the federal levels and policies mandated for physical activity within the schools, the nutritional policies as it relates to the schools, and the results of a sedentary lifestyle. First, ecological approach, super simple. So it's basically the energy intake and the energy expenditure. How do those 2 balance out for you? One must expend more energy to oxidize fat to alleviate energy imbalance. This formula prevents obesity. So knowing this, it will help you live a more healthier lifestyle. So number 2, the policies on the federal level and the state level as it relates to physical education. There's no support right now on the federal level, but you do have the state regulating to the local and district levels the regulations and the requirements and policies for the schools. You also have the community organizations and private orgs out there with different school activities and different sports activities where children can get involved and be more physical and give more time in a more physical way. Number 3, nutrition. So on the federal level, you have the meal program. That's the nutritional line that the kids have an opportunity to go through. And then you have the unregulated line with the honey buns and the fruity snacks and sodas and things like that. So you have an imbalance, but right now that's the imbalance that you have. So what the focus is going to be is to ensure that with the federal and state levels, we get more of a balance so that you can have more of a nutritional value during the school and not just one line to go through where children can only receive that nutritional value, which is that federal regulated line. So the consistency needs to improve throughout the schools for that. And the 4th is a sedentary lifestyle. So past generations, the adults now they've walked, right? They walked to school, they walked to stores, they walked different places and rode their bikes. Now children are riding the bus, they're riding to school with their parents and things like that. They're not coming home and playing outside. They're going home and getting right on their laptops, getting on their phones, getting on their computers and video games and things like that. So they're not as physically involved as we were in the past. And so that leads to a sedentary lifestyle, which leads to childhood obesity. So 11.7% of boys ranging from 3 to 10 do not participate in sports at all. That is not good for the health of our children. We need to get our children more involved within the communities, within sports activities, out of the house, off of those phones, off of those computers and video games. So, in conclusion, childhood obesity is a public health concern affecting the United States and surrounding nations. There are several contributing factors in which you have just heard. However, the appropriate education and resources, childhood obesity can be prevented. This topic was selected due to the high prevalence rate and the need for change within the communities. There is not enough physical activity and proper nutrition being enforced within the households or communities which contribute to this problem. So CATCH is a very good model, and we should all try to adopt that model so that we can decrease the childhood obesity rates. Thank you for your time. I have addressed the problem, childhood obesity. I have provided you the program evaluation of CATCH program, and I have provided you the lessons I've learned. Thank you again.